Hello everybody and welcome to the Sleep Matters podcast from Dreams. Everything you need to know about how to get a good night's sleep and why it matters so much. I'm Dr. Pixie McKenna and in this episode we're chatting about the impact of alcohol on getting a good night's sleep. And I'm really pleased to say I'm joined by Dr. Sara McNeillis, and Sara is a specialist in the diagnosis and management of sleep disorders, so very much needed at the table today. Welcome.
Thank you.
And we also have Claire McCartan. Welcome, Claire. Now, Claire actually gave up drinking alcohol and she's here to share the impact that it's had on her life and, of course, her sleep. So I guess the first question is, ladies, how did you sleep last night?
Really well, thanks.
Yeah.
Good night's sleep.
Good night
no
for you.
complaints there, yeah.
And how about you?
That's good to hear. Yes, I have a very good night's sleep, I'm pleased to say, most of the time.
Good, good. In your experience with regards to sleep, so you obviously sleep well now.
Yeah.
What was the relationship in terms of alcohol and sleep for you, Claire? And what was the sort of backstory to it?
Yeah, so it wasn't something that I really noticed at the time. Probably, I started drinking as a teenager and drank throughout my 20s and my early 30s. It kind of got to the point where I was drinking about a bottle of wine a night. So I would have a bottle of wine with my dinner. Perhaps I would go out for a few drinks after work. I didn't think it was a huge amount to drink, but it was every day. And because it was such a pattern, my sleep wasn't really something that I thought about. So after drinking, I would probably go to sleep at about 11 o'clock and I would go to sleep quite quickly, almost sort of passing out. But then I would always wake up at about 3 or 4 in the morning and I would feel really anxious and I would kind of be like sweating, like having hot and cold flushes. But I just, again, because it was kind of every night, it wasn't a big deal. And I would just go back to sleep and then I would wake up at 6:30 for work. But I would just feel a bit tired in the morning and tired throughout the day. So I think I was just quite tired all the time. And then I would sort of get through the day and I would perk up when I had another little glass of wine with my dinner in the evening. So it sort of turned into a bit of a pattern for me.
So the slippery slope there, definitely, I think.
I think that's a very common factor. We all feel after a stressful day we need something to relax us, and we know that alcohol has this kind of disinhibitory effect on the brain and takes away a lot of initial anxieties in small amounts. But if it's a regular event, then obviously it's going to impact on a lot of sleep processes which people weren't aware of for a while. And new research has shown us that this is actually quite an important factor in maintaining good sleep. I see a lot of patients who have similar stories with this, particularly those who are snorers. I see many snorers in my clinic, and a lot of snorers seem to always say their snoring is much worse, much louder after a night's drink.
And do they join the dots between the alcohol and the sleep? Do you find patients?
They often aren't as aware as I'd expect somebody to be, but I think the eventuality of when their daytime function starts suffering, then they start trying to unpick what's going wrong with their sleep, and that's when people start thinking, is it the drink at night after with a meal, which is it not getting to bed on time, and there's a number of factors due to that. We know that alcohol, although it gets you off to sleep quite quickly, and a lot of patients of mine who can't sleep use it as a method, it does wake you up in the middle of the night because the effects wear off much faster. And the disruption you have with the patterns in sleep are slow to recover.
So it's knocking us out because it's obviously got a sedative effect. But then once that wears off, is it that it's waking us up in the middle of a particular cycle, or it's giving us just rubbish sleep? The sleep that we're getting, I'm just guessing, is going to be rubbish sleep. It's not going to be quality sleep.
It's not quality sleep. It's not natural sleep for sure. Mm-hmm. And what happens is that when you build up a disruption in sleep, you build it up as a debt. So if you have suppressed your natural sleep, it kind of catches up with you. And with alcohol particularly, in the middle of the night you wake up because whatever sleep it has artificially given you, it's not enough to continue sleep naturally.
Right.
So your body processes of sleep are out of sync.
Okay.
And there's a particular sort of process called process S that a lot has been spoken about. This is the process that makes us sleepy as the day goes on.
Right.
And if you drink alcohol, it boosts that process, but then that process wears off much more quickly, and then we burst up awake, as Claire has just suggested at 3 a.m.
Process S. I've never heard of that. Wow.
And this is exactly the same process that we use coffee for, to try and stay awake. We kind of suppress that process by drinking coffee.
Did you take coffee? I mean, how did you get through the day?
Coffee, yeah. Definitely coffee. And also sort of probably eating a bit more junk food than I would now. So drinking sort of impacted on a lot of areas of my life. So now that I don't drink, process S makes total sense to me, because I have more energy in the daytime. So I find that I'm doing more active things in the day. And then by about 9:30 at night, I'm really tired. But to me, that's quite unusual, because for years, 9:30 would be, oh, let's just have another glass of wine. I'd almost have a sort of second wind at that point. So it was as if I wasn't really accepting my natural state of being tired at that point in the evening. So I was kind of behaving in an unnatural way that my body didn't want me to.
I guess for you, it was probably a vicious circle. Then you had the alcohol to relax, then it got you off to sleep.
Yeah.
And then the following day you felt rubbish and you thought, oh, I can't wait till it's wine o'clock time. And
yeah, I was kind of stuck in a bit of a rut, really. Yeah. So I would work, come home, have a drink, work, come home, have a drink. Socialising would be going out, having a drink. At the weekend, I'd probably be a bit hungover. So, but I'd think, well, everyone is. This is what everyone does. So I wouldn't really think much of that. But what I found with giving up drinking is that I just have so much more time, and so I do different things with my time. I exercise. Because I've got more time, I do more cooking. So I found I really enjoy cooking, and that means that I eat more healthily. So it's really kind of like an all-over change in routines and habits.
Your sleep is great now.
Yeah, my sleep is really good. That's one of the first things that I noticed when I gave up drinking, was that I would just sleep through the night without waking up feeling anxious. And that was a real revelation to me, because that was something that I'd been doing for years and years. So it was lovely to wake up hangover-free and just feel sort of like my batteries were recharged and well rested.
And for patients, I guess, similar to Claire, when they can't sleep, is that one of the things you go through in their alcohol consumption? And is that what you...
Yes, we absolutely do.
Yeah.
We ask for, we generally ask about their alcohol and caffeine consumption. We want to know what time they're drinking, how much they're drinking, and how long when they go to sleep, and how long they stay asleep for. Exactly how Claire described. You use the wine or alcohol to get you off to sleep, and it tends to be, in most cases, I must say, Friday nights seem to be the most that people consume, and that consequently shortens their sleep time on that Friday night, and then they end up catching up on a Sunday evening before they go to work on a Monday. So we look at these factors as sleep diaries. And, everyone knows the Friday night effect because you've worked really hard, and I'm sure we, as a junior doctor, I did absolutely the same thing. You finish off your hard-working week and you all
don't know what you're talking about now.
And at least you think, well, let's de-stress from the week ahead. But now I also rarely drink, because I think sleep is so important, and I know it's so useful to have a good night's sleep, and find that now anything that affects that I'm reticent to try and obstruct my sleep, or reticent to try and use anything that would affect it in an adverse way.
It's funny, isn't it? So
it's almost like so focused on it.
Yeah, so it's a bit like
the opposite when as a junior doctor.
Exercise, where people might say, well, no, I'm not going to do that. I'm not going to eat that because actually that might be really good for me because I'm going on a big run tomorrow. Whereas I don't think people feel like that about generally think like that about sleep. We don't. I suppose we just don't see it as we take it for granted, and if we can't sleep, we just say we can't sleep, and if we can sleep really well, we say, well, we can sleep really well. Yeah. But we don't necessarily try and work out why may I not be sleeping well, and actually are there things that I'm doing, particularly alcohol, that will ruin my night's sleep tonight and probably for the whole weekend.
But again, as Claire alluded to, when you're young, you have so many more mechanisms of tolerance, which tend to wear out as you age. And
you have more time anyway, haven't you?
Yeah,
you have more.
Absolutely.
Have you noticed that?
Yeah, definitely.
After a certain age, you feel that you don't have that mechanism of tolerance anymore.
Yeah, no, you definitely do. I mean, I know when I was certainly capable of having nights out sort of when I was in my early 20s, and then I'd be at work in 7 o'clock the next morning and I wouldn't feel that bad. But as I got a bit older, I definitely found that the hangovers were getting worse, and that also I'd have a bit of a sort of foggy head the next day at work. I wouldn't have so much of a clear mind. So I think definitely I noticed that alcohol was catching up with me.
So in terms of, binge drinking, I mean, is it the consistent tipping away, or is it the binge, really, really good Monday to Thursday, blowout Friday, Saturday? Which is the worst, or are both equally as bad for your sleep?
I think both are equally as bad, but we know that binge drinking is probably going to adversely affect many body processes, not just the sleep process. Mm-hmm. But I think a regular drink in the evening is all equally disruptive on sleep. We've not seen any studies that suggest that you can have one glass and sleep well yet.
Ah, right.
We
okay.
It is quite a profound substance that
even one drink
can affect your sleep.
God. So when did you just go, I can't do this anymore?
So as I described, I'd had the kind of steady drinking pattern, and I felt that was totally under control. I'd always had a drink. I'd always held down quite a high functioning job. I've got 2 children. They were doing well. So everything seemed fine to me. But then I had a sort of personal tragedy where my dad died very suddenly. And I found that my drinking just spiraled out of control really, really quickly. It wasn't something that I expected to happen at all. But it was really quite frightening the way it kind of took over my life. And so it definitely got to the point where I thought, I just can't touch another drop of alcohol. This is really, really dangerous for me.
Okay, and you just said, that's it?
Yeah.
So rather than, did you feel that it wasn't really an option to moderate your drinking, that you just needed to cut it out of your life?
So I had tried moderation, and I think I'd always kind of moderated throughout my life. So every now and then I would have maybe a month off drinking. I would have a little dry period. But I think looking back now, that was kind of to justify my drinking. So I can go a few weeks without drinking, so it's fine that I drink for the rest of the time. It's not a big deal. But certainly towards the end of my drinking, conscious moderation was not working. And I was actually finding that it was more stressful than not drinking at all, because I would kind of count the units. How many units am I allowed today? And, sort of obsess over it. Well, I haven't had a drink yesterday, so I can have one today. And it was just a bit of obsessive thinking that it was much easier to cut that out of my life completely than to moderate. And I think if you're moderating, why are you moderating? Do you know that that's bad for you? And if you know that, then why are you doing it? So, I was asking myself these questions, and I thought, I think that actually drinking is really dangerous for me, and the only way for me now to stop it progressing is to just stop completely.
Would you see that in your patients, that they would rather, I mean, I know from my patients, most people will say, okay, I'll have 5 alcohol-free days, but I'm not giving up my weekend, or I'm not, I'll have one treat day in the week. I mean, do you find it difficult to make people give up completely?
I do. I find it incredibly difficult to try and get people to give up drinking completely. And it does often take a significant event, such as they've lost their job or they've been they've been moved into another room because I come to just alcohol and snoring, because it seems to be a lot of my patients are heavy snorers with sleep disordered breathing and sleep problems, breathing problems at night, and want something social, such as you've been moved out of your bedroom, then they seek help. Mm-hmm. And then even so, I think that it's difficult to change a habit which has been there for a long time. And I say to my patients, any habit can be modified. It takes time, and you've got to want to do it. And sleep is equally a habit that we've got to want to promote, a good habit of sleeping. And they do go for psychological help and assessment to deal with that as well. A lot of my patients do realise that once they are on treatment, say, for example, a severe sleep apnea patient would have to use a mask every night, and they don't like using these masks. So that would then switch them over to, I must give up drinking, I must become healthier generally, I must, my sleep will improve with that better without having to use this for the rest of my life. And I think that's a good thing. A transformation is a great thing, and I love to see patients who've transformed their life patterns and improved their sleep, and they come back and they feel so much better. They look better. And I haven't even, anecdotally, I say to them, you look better. And it's because they're sleeping better.
Yeah, it's amazing, isn't it? Did you notice, did it take a while? Did you notice when you stopped in terms of your sleep and general well-being?
Yeah, I noticed fairly straight away that I was having really good night's sleep. So that was amazing. And I think my health just started. I hadn't really thought I was in bad health, but people started to say to me, oh, you look nice today, or oh, your skin looks really nice. And I realised, that gradually over time my eyes looked a bit brighter and my skin was clearing up. So yeah, and I just felt healthier as well. I also, when I was drinking, I had a lot of back pain. And when I gave up drinking and started exercising, it just completely went away. And that was something that I'd suffered from for years. Also, my anxiety, which I think went hand in hand with drinking. I don't think I'm naturally such an anxious person. But with the drinking, that again became a sort of vicious cycle, because I would be more confident once I'd had a few drinks, but then I would need them to be confident. And so anxiety was caught up in that as well. So that also started to improve, and my confidence in general started to improve. But I think that was more a gradual process, which is why I kind of think dry January isn't really long enough. I think my first month giving up drinking, it was still very much focusing on not drinking. Whereas now I just know I'm not going to drink, so I can focus on staying healthy and doing other things and finding new hobbies, doing what I like, and finding out who I am really. But that first month, it was just like, right, I'm not going to drink. And so I think it's nice once you get over that phase and you accept that, and then you can move on from that.
Because I suppose you go from that stage where you're not drinking to I don't drink. It's like that point. There must be a point at which you describe yourself as a non-drinker versus I'm off alcohol. Yeah, precisely. Yeah, and so I think, but the first month, it's just like I'm having a dry month. But then when you push past that, it just becomes a natural part of your life. So how long is it since you've had a drink?
So it's been 2 years since I've had a drink.
I'm going to ask you the question that everyone asks you. Do you miss it?
No, honestly, I really, really don't. I really don't. And I've also met so many people who've given up drinking over the past 2 years. And they've been a mixture of people of different ages. Some have had, sort of alcoholic rock bottom. Others have just had their dry month and pushed past that and carried on with it because they liked it. And I've never met anyone who regrets giving it up.
Yeah.
Yeah.
Do you find it that your patients, when they remove alcohol as a part of the sleep issue, that it becomes much easier to get them to change other habits, to change other bad sleep habits?
Yes, absolutely. It's part of the whole sleep hygiene routine. And although there isn't any strong evidence for the package of sleep hygiene, the first step of reduction or abstinence of alcohol is one step towards focusing on what is important, which is a good routine to promote good sleep. And it goes in hand with exercising at the right time, eating the right meals at the right time, and making sure you get regular bedtime hours and regular wake time hours to promote the natural process of a sleep. And patients who do struggle with this, and I'm sure, I don't know how many people do struggle with changing habits of that have developed over a long time. And I do say to them that, look, one step at a time. If you can do one thing at a time, just keep going at one thing, the next thing, the next thing. Don't try and set yourself such a big, hard target of, I'm going to give up drinking completely. Start with, say, I'm going to cut off drinking at this point because it's going to affect my sleep after a certain amount of time, such as don't drink coffee until after 2 o'clock, ideally. Although there's a study that says coffee just at bedtime doesn't have as much effect on sleep as coffee 3 hours before bedtime. And I'm mentioning coffee because a lot of patients use coffee as an antidote to the alcoholic sedatives. Yeah. You go out for a meal, you're feeling a bit sleepy by the end of the meal, and you have a coffee boost before to go home.
Double espresso.
Precisely, this is it. And then that then sort of, you've got this double whammy of this sedative that's trying to promote your sleep, get you off to sleep. Yes, and then the coffee fighting it again. So I said, look, cut it all out and then, take it out, take one step at a time. And so many patients who've made that change have said to me they are really happier overall. They're more productive at work. They are, less troublesome for their families, such as they're not snoring loudly, not disturbing other people's sleep. And this is a whole thing about sleep is it's not just your sleep you might be disturbing. Waking up at 3 might be disturbing your partner's sleep, and the health implications of disturbing anyone's sleep in general, whether it's yourself or others, is equal in some respects, in long-term health respects.
It's interesting, isn't it? Because I think there's a whole educational piece around alcohol and its relationship with sleep, because most of my patients, if they drink too much, will be worried about their liver, or they'll have come because they've done something foolish and they've got themselves into a situation which you have to try and get them out of, or there's an event. But sleep, I don't think I've ever had a patient come to see me that said, I can't sleep and I think it's because I'm drinking too much.
I know.
They just don't make the link.
They don't. There isn't. It's very difficult to make that link because of the effects of alcohol getting you off to sleep. They don't realise that the getting off to sleep is only part of the whole sleep process. Staying asleep is as important as getting off to sleep. So people don't realise. They think the early morning awakening that Claire had already alluded to is due to something else, and I suppose that link is very, very difficult to establish.
So what would your tips be, your sort of takeaway message to people, Claire? Because you've done this, you've lived this, you've been on both sides, and you're obviously happier on the side that you're on now, which is great. What would you say to people who maybe can't sleep and have similar habits to those you had previously?
Well, I would say to, give it a go, giving up. It can be done. I'm living proof of that, and I drank regularly for years and years. I'm so much happier now. My entire life has changed. My relationships with people are a lot better. Sleep is amazing, and I'm just so much healthier. So I would encourage people, if they feel that they have a problem with alcohol and that it's interfering with their sleep and their everyday lives, to not be ashamed of seeking help. You know, it is an addictive substance, so there's no shame in being addicted to something addictive, you know. So yeah, the help is out there and people will be very understanding. So I would say just give it a shot and see how it goes. Like I said before, all the people that I've met who've given up drinking don't look back. You know, they all come out the other side much happier and healthier.
Did you do it on your own? Did you just say, right, I'm done?
I made the decision, yeah. I mean, in the past, I'd kind of tried to give up drinking, but I hadn't really been successful in that and just ended up drinking again. So it did take that big traumatic event and kind of going too far with my drinking. And it was obvious to everyone that, you know, I was in trouble with drinking. So I made the decision on my own, but I sought counselling. I went to AA at first, and I worked on my support network. So I told my close friends, because I thought it's putting myself in a risky situation. I didn't want to not go to pubs and meet them for a drink, because that was what we did. But, you know, I was careful to tell them beforehand, you know what, I haven't been in a great way recently. I'm not going to be drinking tonight. And then they knew, and it wasn't a big deal. And if anything, I found that quite a lot of my friends were relieved and that they'd had a few worries about their own drinking as well. And they were quite happy to have a night with mocktails rather than triple vodkas all night long. You know, it was actually a relief to them. So, yeah.
So you can, if you think you need to, you should just do it, you'd say?
I think so, yeah. I mean, I think if you have any doubts about your drinking, then there's probably a reason that needs to be looked into.
And for you, what would be the top tip for anyone who's perhaps thinking they're drinking too much and they're not sleeping?
Well, I think that to try and think about your whole sleep cycle, and if you're not sleeping, something's affecting it. We're naturally programmed to sleep. And drinking is one of the main social things that we do. So I'd like people to make the link between drinking and sleep a lot more. Maybe, again, as Claire said, seek help, cut it back, try and work out a good bedtime routine, which does involve not drinking too much late in the evening. Just awareness of that sleep is not something to be ignored, and alcohol does affect sleep.
Well, do we all think we'll sleep well tonight?
I hope so.
Good. Thank you so much, Claire. Thank you, Dr. Sara. I think that's really interesting because we've got it from both sides, the patient side, the doctor side. That's really, really good. Lots of tips for everybody there. Thank you for watching the Sleep Matters podcast from Dreams. If you enjoyed it, then please press the like button below. And if you want to see more, then you can subscribe to the series.